Welcome to Radiology Made Easy. Today, we're looking at a case involving the cervical spine, illustrated by these X-ray images. Here we have anteroposterior and lateral views. Notably, there's evidence of a spinal board, indicating that this is a trauma case. We observe a loss of normal alignment of 3 spinal lines at the C5-6 level, with anterolisthesis of C5 on C6 by approximately 1/4 of a vertebral body width. Additionally, there's a noticeable loss of normal facet joint alignment, particularly evident with a bow tie sign on the lateral view, most clearly seen at C5. This sign suggests a potential unilateral facet joint dislocation. Importantly, there are no convincing fractures identified in these views. These findings are most consistent with a unilateral facet joint dislocation. While typically considered a stable injury, the significant trauma experienced by the patient warrants caution. Due to the limitations of these views, they shouldn't be the sole basis for evaluation. I recommend immediate referral to the clinician for further imaging, specifically a CT scan of the cervical spine. This will help confirm the diagnosis and check for any other potential injuries, ensuring the patient's spinal support is maintained. When diagnosing cervical spine trauma, it's crucial to ensure the entire cervical spine is adequately visualized. Count the vertebral levels from the base of the skull to T1. If the cervicothoracic junction isn't clearly visible, mention this and consider additional imaging, like a swimmer's view or CT scan. Be mindful of potential injuries like Jefferson's fractures, which may not be obvious on standard views. Always check for the alignment of 3 lines on the lateral view, anterior to the vertebral bodies, posterior to the vertebral bodies, and anterior to the spinous processes. All facet joints should be properly aligned. Also, don't overlook the importance of evaluating the soft tissues. On the lateral view, soft tissue thickness should not exceed 7 mm at the level of C2 or 22 mm at the level of C6. Finally, review key areas like Harris's ring, which can indicate fractures if disrupted, and ensure that the base of the skull and sphenoid sinus are checked for potential fluid levels. In this case of unilateral facet joint dislocation, the injury typically results from a flexion rotation mechanism, commonly occurring at the C5-6 level. Unlike bilateral facet joint dislocation, a unilateral facet joint dislocation is usually stable and best visualized on oblique radiographs of the cervical spine. It is characterized by a bow tie sign indicating rotated facets. Here, we see a minor anterolisthesis of C5 on C6, less than 1/4 of a vertebral body width. Axial CT images reveal the loss of normal facet joint alignment, evident as the absence of the hamburger sign, a key indicator of such dislocations. These findings are consistent with a locked facet joint, as shown in the sagittal reformats, where the usual hamburger sign is absent. Thank you for watching Radiology Made Easy. Remember, every image tells a story, and we're here to help you decode it. We strive to provide you with valuable knowledge in a short amount of time, and we hope this helps you in passing your radiology exams. Stay curious, and see you next time. Please comment below with your thoughts and suggestions on how we can improve our content. Your feedback is always appreciated.